4.
5.
Me, 6.
7.
8.
9.
10.
11. 12.
Thanks for everybody coming tonight. My speech this evening is going to be on organ donation and why it's a good thing for everybody to be an organ donor. If you can picture, I work in an ER. I had a patient last week named John Doe come in. He was extremely sick. He came in with sepsis and ended up later dying in the emergency room. He was an organ donor, but unfortunately, because his wishes were not conveyed to his family, he was not able to become an organ donor. And unfortunately, at that point, we could not harvest any organs or tissue to help anybody else. So why is organ donation so important? For many reasons. It's an easy process, but you also have to make sure that you know the process and get it taken care of and make sure you follow the rules that need to take place. How many of you have taken steps to become an organ donor? Okay. Some of you claim to be organ donors, but have not followed through with the necessary steps to finalize the plan, believe it or not. If you are not an organ donor or have not completed the plan, today is the day for you to make the very important decision to become an organ donor. First, I'd like to provide you with some statistics. Then let you know how to become a donor and why you should become a donor. Out of everybody that raised your hand, there's roughly 66% of you that claim to be organ and tissue donors. Did you know, actually, in the United States, the average for people to be organ donors, is actually 45%, so less than half. So if this is the actual population of the United States, only about 5 of you would actually be organ donors. Currently on the organ donor registry list, there is approximately 123,000 people waiting for an organ or tissue to help save their life or make their life better. Out of that, only approximately 80,000 are actually medically cleared to be able to get that organ at this moment. What that means is about every 10 minutes, somebody is added to the registry. Unfortunately, though, because of the lack of organ donors, about every day, approximately 22 people die while they're waiting on the list for their organ to come for them. On average, one organ donor can save or improve 8 people's lives. On average, one tissue donor can save or improve 50 people's lives, believe it or not. Just think if you could help save and improve as many as 50 people's lives, even if it meant that you passed away and left your loved ones behind. So are you ready to become an organ donor now? You may ask how. First step that a lot of states have in place is to register with the state registry, whether it be your driver's license. Some of them you have to actually go to a website and sign up with the state themselves. On your driver's license, there's generally a spot on the back that you have to sign, and it needs to be, in some cases, witnessed. And then you also specify whether you want just a certain organ or your entire body to be donated. More important, you need to talk to your family. Even though you're on the registry, families may not want that, and you need to convey your wishes to your family so that they know what you would like to have done with your body in case you do pass away untimely, or even if it is a timely passing. They may have to sign consent, being power of attorney, whatever the case may be, to harvest your organs. As you can see in the case with John Doe in the ER, he didn't speak to his family about his wishes, and his wishes were not able to be carried out. So unfortunately, the potential for people to get an organ and save their life, that was lost. Informing your family is very important. That way they know exactly what you want to donate and what your wishes will be in the long run. As far as organs that you can donate, hearts, kidneys, lungs, pancreases, intestine are just a few of the organs that you can actually donate. Tissue that you can donate include tendons, corneas, skin, heart valves, bones, blood vessels, and even bone marrow. Believe it or not, you can actually donate upon your death as well. If you're making a living donation such as a kidney, you may also undergo complete physical and psychological screening beforehand to make sure you're fit for the donation. Donations after death will be medically suited to the time and need of donors recipients and the donor themselves. The age of the donor does not matter. Donation depends on the donor's physical condition and medical condition. Previous medical conditions does not disqualify anybody for organ donation. The process to donate organs is really quite simple, and the benefits are more than self-rewarding. Organ tissue donations help prolong life and aid in research and education. The way it prolongs life, as many as you probably can figure, is somebody needs a heart, you can get a heart, and you can continue to live for several more years with that. Organs fail, such as kidney, liver, and you don't necessarily have to have psoriasis from drinking. It can be a psoriasis from another disease process that you have no control over. And through organ donation, you'll have a second chance at life. Weakened tissue, such as heart valves, from congestive heart failure. As time goes on, you can get new heart valves and still continue to live a full, healthy life. Tissue replacements such as skin or tendons from trauma or burn victims from cadavers also help aid in the recovery of those patients. Research and education is a big one. Through research, bodies are used for test dummies in motor vehicle accidents rather than just the electronic dummies, because you're able to simulate crash scenarios and can't think of the word, and the impact it has on an actual body rather than the dummy itself. Other research that they use it for is, say, a brain from a patient with dementia or other neurological disorders. That person may donate their brain to help further neurological science testing. The entire body medical schools use them, not only to help train doctors, but also to help train surgeons when it comes to time for a difficult surgery that may be a very rare surgery. The doctors can go in and actually perform the operation on that cadaver and not have to risk the patient's life, and that way they understand it a lot better in the long run. Also, in medical school, the doctors get to explore the human body and actually see what's on the inside without having to actually cut open a live person. Forensic science, of course, a lot of us are familiar with the show CSI. They use human bodies and body farms that help dictate human composition under different circumstances, whether it be weather or other situations that may happen, say, for a murder. The condition of your organs, so you may also say, but why should I be an organ donor? I have a chronic disease. All these, there's a lot of rebuttals you can say that you can't be an organ donor. And to a lot of those, I'm going to tell you they're false. Say you have a diseased pancreas. Well, I've got disease, I can't do it. That's false. Just because you have one disease organ doesn't mean you can't give another. Religion. There's very few religions out there that actually are against organ donations. A lot of them support it and leave it up to the person to actually make that decision themselves. A lot of people may be worried that if their loved one's in the hospital in a coma that they aren't going to get the quality of care from the doctors. That's completely false. Every doctor and nurse will always give you their best to their ability. They would rather see you walk out of the hospital instead of harvest organs. One of the other common ones is, what about an open casket funeral? A lot of people would like that. Organ donation is also done as a surgical procedure, so all incisions are surgical in size and nature, so they're always closed up and you won't see them once the body is dressed. So altogether, as you see, unless you are one of the few religions that do not believe in organ donation, there is no reason you should not do it. I encourage you to go out today and register to be an organ donor. The process is easy. and think of the number of lives you could save or improve.